Folks, something very common in the dental office is when a patient comes in with receding gums or with wear on the neck of their teeth. Now, both of these conditions cause tooth sensitivity. They both look bad. Both require treatment, but if we perform the wrong treatment, we could, instead of helping, do more harm to our patient. In this video, I'm going to tell you what these two types of problems on the neck of the teeth are, how to tell them apart, and what kind of treatment they require. I'd like to remind you that everything is supported by scientific articles, which I'll leave in the video description. And I'll give you a heads up that many of these problems are not treated by placing resins on the necks of the teeth. Let's start by differentiating between the two conditions. One is gingival recession, the famous receding gums. Here, the gum recedes, leaving the tooth exposed and making it look longer. Normally, this causes tooth sensitivity, and it's not at all aesthetically pleasing. The other problem is called a dental abfraction, better known as wear on the neck of the teeth. Here, a part of the tooth breaks off, usually at the neck. The treatment and the cause for both are very different, and that's why it's super important to know the difference. Now, sometimes both problems are present on the same tooth, and therefore we also have to combine the treatments. The most important thing is to avoid, at all costs, making the mistake of treating a gingival recession as if it were a dental abfraction, or vice versa. Let's start with gingival recession, better known as receding gums. First of all, what causes it? It can be due to a poor brushing technique, an excess of dental plaque, periodontal disease, and orthodontic treatment, meaning braces, that had excessive forces or movements. Due to iatrogenesis or professional error, habits like smoking, and also from having piercings in the tongue or lips, as well as other objects that constantly hit the gums. Once we know what caused this problem, we have to treat the root of the problem, of course, before performing the corrective treatment. For example, you can't perform gum surgery to return the gum to its place if the person still has plaque, or if they don't want to quit smoking or won't remove their piercing. Once the root problem is treated, we can proceed to correct the gum recession. The only way is with periodontal plastic surgery, that is, gum surgery. There are many techniques, and for that, I'll leave a video up here that I recorded with a periodontist where we talk about that. Now, one of the most common mistakes is to place resin on the neck of the teeth when the problem is gum recession. Think about this, what you lost is gum, so the logical thing is to replace it with more gum. Not with a rigid material that creates volume where it shouldn't exist. This could trap food and won't fix the aesthetic problem, since the tooth will continue to look longer. It partially removes the hypersensitivity, but that resin can in turn cause more recession because the resin is not completely compatible with the gum. So, in summary, gum loss or recession should be treated by adding more gum tissue, or even leaving it as is if it doesn't bother you. Now let's look at abfraction, the well-known wear on the neck of the teeth. These have a very different etiology, and the condition, although it can also present with tooth sensitivity, must be treated completely differently from gum recession. Cervical lesions, or better known as wear on the neck of the teeth, have a prevalence of over 50% of oral diseases in the adult population. For many years now, and according to Dr. Stefan in 2005, it has been shown that this type of lesion is mainly caused by excessive biting forces applied to the neck of the teeth, which is mistakenly confused with a poor brushing technique. As we've already seen, an aggressive brushing technique can indeed cause gum recession, but it's very uncommon for the brush to wear down the neck of the teeth. Now, as I mentioned earlier, first you must treat the cause, which in this case can be a bad bite or a bite with excessive force. How can it be treated? Well, it can be treated with orthodontics to correct the position of the teeth. You can also be given an occlusal guard, those little devices you put on your teeth to avoid excessive dental contact and work on improving the bite. And you can also resort to placing a prosthesis or resins on the teeth to modify and improve the bite. That's in very extreme cases. Once the root problem is treated, it's time to repair the damage. And that can be done in 3 ways. If the wear is very subjective and there are no symptoms, only the root cause is treated to prevent the wear from getting worse. Number 2, if there is already sensitivity and there is little wear, we proceed to seal those exposed dentinal tubules. Those tubules are in the dentin, and liquids and thermal changes filter through them, causing sensitivity. For this, they can be sealed with sodium fluoride, potassium nitrate, or potassium citrate, which are products that can only be applied by a dentist in a dental office. At home, you could try using toothpaste for sensitivity, which in many cases can work very well for you. Now, point number 3, when there's noticeable wear and sensitivity, resin-modified glass ionomer composite restorations can be used. What is this? Basically, it's a special resin that we dentists use to place on the neck of the teeth. Now be careful, the material used must compensate for the flexural stresses of the tooth. They normally require an elastic modulus of around 8 to 9,000 megapascals. Why is it important to know this? Because the material we dentists use will make the difference between the success or failure of the treatment. Okay, so let's summarize everything. Basically, if what's missing is tooth, it should be replaced with a solid material, respecting the anatomy and not creating more volume than necessary. Likewise, if what's missing is gum, it should be replaced with soft tissue, that is, more gum. Now, if the conditions are combined, both techniques can be used to restore the lost tooth with resin and the lost gum with gum tissue. Knowing the difference in these conditions will give us the opportunity to correctly treat our patient's teeth. But remember, if you're looking for an expert who performs these treatments, you can find one at conexiandental.com, the platform for dental experts near you. I recommend you watch the videos I have on gum surgeries, which I'll link up here and in the video description. If you learned something new, don't forget to like the video and share it. Subscribe to the channel if you're interested in watching more videos made to help you improve your health. See you in the next video, and I hope you're doing very, very well.